First of all, I would like to thank Dr. Venkatesh sir for giving me this opportunity, coming back to my alma mater and present this very favorite topic of mine. Uh, why we need to implement this technology and skill integration for effective teaching. As we know, in today's rapidly developing educational landscape, integrating educational technology is not merely a trend. It has become very imperative. We cannot, live without technology in our teaching now. Technology has permitted into every aspect of our life. We know from smart homes to smartphones, everywhere technology is there. Whereas if we look at the medical knowledge, what is the amount of medical knowledge what we have in present times is changing very rapidly. Every 6 to 8 years, it keeps on doubling. And we have very difficulty in retaining the factual information. And we need very innovating learning tools to get all this medical knowledge which is updated and get to go along with it. Whereas our traditional teaching, where medical colleges or any institution, mainly based on our lectures, textbooks, and structured lessons, here the students will be more of a passive recipients than active participants. And most of the time, it will be just memorization and rote learning will happen. We need to break this traditional teaching, and as our role as teachers, we need to have our lectures which is improvised. There should be an interactive teaching methods, morely of concept-based teaching. We have to simplify the complexity. The material is available online or everywhere so easily. Our job becomes here to simplify the things, whatever is available, and we have to make sure that the overall outcomes improves in the students. How we can improvise our lectures? We know that lectures is the most common way of teaching our students. So it is a direct delivery of information from the teacher to the student. It is more practical and convenient, where we can approach more number of students, and we should take it as a more efficient way of communication. So by inculcating simple technologies, by just building lessons using differentiated instruction tech, we can even gamify the learning experience, and we can use social media as a teaching tool for all the students who can be directly related to us, or it can be remote also. So these technological tools at present, what we have simply we can inculcate is the most commonly what we do is our PowerPoint presentations. There are so many webinar apps, and there are video lectures which we can be recorded and we can be streamed, and we can use the polling or quiz platform to encourage students to learn and answer better. Our teaching should be more of concept-based teaching. There are lots of theories available, but nowadays these Gen Z students are more more interested in learning things faster. And if you keep on talking more of theories in our lectures, the students will lose the interest. And if we teach more based on the concept, then it will be more easier for them. It should be more on why and how, and the concept can be made simple with the technology. So this is just an example to show that in an Horner syndrome, most of us, we try to remember and mugify the symptoms. Just with simple animation, we can just show that in case of Horner syndrome, there will be a ptosis, there will be a meiosis, there will be an enophthalmos, and there will be anhydrosis. So this simple picture in our presentation can make lots of difference because we are visualizing what is happening. So this may, easily we can remember this, and we can tell that this is ipsilateral. So this one simple diagram will save lots of, our effort. And we can highlight the point which we need to remember. This becomes a triad of Horner syndrome. So a simple slide, a simple animation with a PowerPoint will convey our things very easily with the students. Similarly, when we are defining a pathway, we can just, use a simple animation like this is a first order neuron, this is a second order neuron, this is a third order neuron, and we can, highlight like if damage happens here or here, here. So this and all can make the students understand the things very easily. And we know that animation makes concepts very simple. So with the concept of, using a simple technology like a PowerPoint to make animations easier to teach complex surgical steps. So as you see here, when we are doing a tunneling, just by healing up the crescent, it is more easier to dissect the sclera, and healing down in the cornea makes the tunnel in a proper plane. So this simple animation will explain that tunneling is easier and we have to keep the blade in proper position. Through this animation, we can convince the students more easily. If we don't change the direction of the blade, it can lead to premature entry. or a buttonhole, which can be easily made understood for the students with a simple animation. A similar example where we just have to inject the visco inside the chamber. If you don't do that, if you just inject the visco at the wound, then it can easily lead to DM detachment. So even just by telling them or showing some complex videos may not make the students understand the simple things, which we can easily do with a simple animation. Similarly, we just have to visualize the inferior edge of the vectis, whatever the grade of the cataract. If you don't visualize the vectis, then that means it is under the iris. So just a simple example, our animation will just tell us that if we are visualizing means it is under the nucleus. If you're not visualizing, it is under the iris. So if you just keep on proceeding the surgery, it can cause paralysis. This is another simple example where when we are doing a cortex removal, this I just label it as elephant rule, that if you cannot pull the elephant with its tail, instead we can similarly, when we are removing the cortex, we just go hold a thread. We will not be able to remove the cortex efficiently. At the same time, we can just pull the elephant with the trunk, just to indicate that if you go for a bigger chunk, then it is easier to remove the cortex. So this will make the students understand that this concept, when they're operating, they'll understand it much better. So this was made initially to teach our students. Then Dr. Venkatesh inspired us to put it online, and we put it in the YouTube, and it went on becoming and acquiring more than 4 lakh views. That means not only our students got benefited with this, there are so many who are remote, which we don't even know them. They still understand, and the concept was very easily reach them with the simple animation and a technological tool. So this was recognized in one of the international library, and they just quoted all our videos, and it became very hit at the internet. Another simple example of showing a PowerPoint is, instead of just teaching them what is dystechiasis, just make a small PowerPoint presentation. We can make 4 points, and we can just ask the student, what do you think the answer? If somebody tells it is misdirected eyelashes, we can just click on the misdirected eyelashes. It directs us to a slide which says, no, it is not wrong. We can just again go back. Again, whatever the options they choose, we can just tell them, look, this is not the way. So this can be easily made with a PowerPoint, where when the right answer is shown, that can be shown with a separate slide. So this is just simple example. And another way of teaching is, whenever there's a picture or whatever, we can just say, we can just put them, ask the students to participate. Whenever they choose one particular, we can just click on the photo, the description will come. So this one all can be made with the simple PowerPoint tool. So overall, what I would like to convey is, first thing is always to getting aware of the tech. Little older generation, we are little worried about the technology. We think that it is very complex. It is very difficult. It is very difficult for us to adopt at this stage, so that, our students will not be able to convince them. It is not like that. The simple technology, as it is advancing, it is also becoming more simpler. The only thing is the enthusiasm is which keeps us learning all these things. Even though there is a learning phase, it is very shorter. Our students can teach us very easily, and we can adopt it in our regular teaching in a step-wise adaptation. Finally, I would like to say we have to embrace the change to make the mark in our teaching. Thank you.